pleasure of interviewing Emily Corba, a physician's assistant at Beaumont Hospital in Troy. Hee-Young Han and Lori Lapp, both doctors and assistant professors at Southern Illinois University School of Medicine, wrote an article that discussed the reading and writing aspects of how physicians use electronic health records can sometimes be overlooked. Results found that physicians with at least 3 years of experience didn't feel confident enough using the technology and preferred to write succinct notes, which are notes that are expressed in short words and phrases. Physicians who were relatively new to the system felt more confident and didn't feel the need to write succinct notes. William Cheshire Jr., professor of neurology and doctor at the Mayo Clinic, conducted a study that argued how online medical records are not always perfect and may make the problem of miscommunication bigger. He wanted to assess if voice recognition technology would produce more errors than a handwritten paper note. Results found that the spoken document contained 65 errors, with 47 of them significantly changing the meaning. It is something like this that could cause major problems when it comes to treating and caring for a patient. When the note mentions anuric acute renal failure, it means that the patient's kidneys are failing and that they require CRRT, which is continuous renal replacement therapy. Also, when it mentions that the patient is suffering from severe hyponatremia, it means that they have low levels of sodium in their blood. This note mentioned that the patient needed a complete head CT, which is computed tomography, and this is like a picture of the brain. It also mentioned acute SDH, meaning the patient has an acute subdural hematoma, which is a clot of blood that develops between the surface of the brain and the brain's tough outer covering. Since consult and progress notes are describing very complex things, they need to be precise and clear, because if something isn't correct, the patient's life could be at risk. Communication is something that we as people do every day. In the medical field, it's an essential aspect since it builds a foundation for effective, high-quality healthcare. The objective of a PA to communicate with others around them is to improve the patient's overall health and medical care.